Hi guys, Nathan here again. Just want to talk to you guys about knee pain in adolescence. There's a few common presentations, but the one I wanted to talk to you guys about today is what's called patellofemoral pain. A very, very common presentation, probably a little bit more common, I'd say, in your female adolescents than in males, just due to the way we're built slightly wider hip width, leading to a sort of bigger angle coming down through the femur towards the knee. Often it will present as an achy pain throughout the knee. It may get sharp on occasions. Often you're looking at things like going up and down stairs, squatting or sitting for prolonged periods of time that will aggravate it, and usually can cause a fair bit of functional loss in terms of gameplay and ability to participate in sports. It is quite a common presentation due to, in my mind, the big growth spurts that teenagers get around that sort of 13 to 15 age group. And essentially their bodies can't keep up with the rate of growth. So they need time to allow the body to catch up. They need strengthening programs. They need to be taught the way to move with these longer limbs. Otherwise, they're going to overload at the kneecap. So patellofemoral pain is essentially a build-up of forces at the kneecap. There often isn't a structural cause for the pain. Usually it will cause by either the lower end at the foot and ankle or by the higher end at the hip. So if we're looking at the foot and ankle, usually we're looking for, are they a little bit stiff through the front of the ankle? Can they not lunge over the top as far as they could? Or probably one of the other common ones is, do they roll in through the foot a little bit too much? In which case we could be looking down the lines of orthotics, low dye taping, foot strengthening exercises to improve that arch control, so that when they hit and when they land, they have more control and those forces aren't shooting straight up towards the knee. If we're talking more so about the hip, often it is going to be a strength issue. Sometimes there may be some stiffness. I'd probably say that may be a little bit more common in your males than in females. But your female adolescents are really a typical population that are going to have those hip strength issues. So you'll often see your 15-year-old daughter may jump up in the air, and then when she lands, her knees drop in together. Or if she's jumping and landing on one leg, you'll see the other hip drop down when she lands. It's a really, really big sign that those glutes aren't quite strong enough to deal with that load. So if we're looking at sort of that knee dropping in, we're getting a rotation through the femur, which is going to increase that force on the kneecap. If we're looking at that Trendelenburg, where the hip's dropping on the opposite side, again, we're looking at the glutes not being strong enough to be able to support the pelvis and the hips in that single leg loaded position. I would say often we're looking at those same sort of things happening with a change of direction, with a deceleration or an acceleration, where they need to build the strength and they need to be able to build the tolerance to be able to perform these activities without overloading at the kneecap. So it can be really, really simple management strategy of some strapping techniques, some hands-on work to release through the muscles, to release through the joints and improve that joint mobility, and a nice, solid, individualized exercise program, often looking at some quadricep strength, probably some foot and hip strengthening, and some core strengthening, and probably some movement education as well. Learning how to move when you're having these growth spurts is really, really important. If your leg is growing by an extra 10%, as may be common in some of these big growth spurts that these kids are having, learning to be able to move and take that load is really, really important. If we're looking at contact sports like soccer, rugby, AFL, being able to land, being able to push off, take contact in the air and land with those same mechanics. It's all basics, but it needs to be well drilled in so that when these kids are growing up, coming into the men's game or the women's game, as is getting more and more popular and we're seeing more and more knee injuries in women, we need to start educating these kids at a young age. In my mind, we need to be looking at that sort of 12 to 14 year age group as our key targets to teach them the way to move and the way to jump, land, change direction, to make them a more robust athlete now, but also when the hits get bigger, when the game gets faster, as they get more towards that 16 and into their 20s, that they're more robust and less likely to get injured. So patellofemoral pain, it's common around that growth period. You also need to look at, is there a change in training load? Is there an increase? Is there a change in sport? Potentially correlating, where we'll have those discussions around about that. But often it's around that strength. How are they moving? How are they taking load? And how are they absorbing that load? That's the key crux of that management. Thanks, guys. Any questions? If you want any videos on anything in particular, let me know. Either send me a message or let me know in the comments. Otherwise, have a great week. Thanks.